I just want to thank you all for inviting me here today. I'm delighted to launch the RE Learning Set in my capacity as Head of Service for CHO 9. I want to provide my support in developing recovery in our area. I suppose I'm going to be a little bit selfish and I'm going to talk about my area, just to say that, you know, I want to welcome everybody from CHO 9 and CHO 7 and CHO 8, but I also know there's CHO 6 and other initiatives are on display down below, and there's a lot of really good work going on around the country. And I know there are some cross-border initiatives that are taking place in terms of recovery, so you can see that it's a whole Ireland initiative, and we've come a long way, I suppose, since 2006, where it was initiated through Vision for Change, 2016, where we're having the review of Vision for Change, and it's very positive for mental health that we've come so far. I suppose I want to also say that another initiative is that we now have heads of engagement in each of our CHOs, and nationally there is a head of engagement, and that shows that the organisation is committed to progressing recovery, progressing the co-production, progressing learning, practice, capacity building for all our service users and their families. And I suppose the one thing that brings it to mind for me is the Detect initiative that's in CHO 6. I asked, could I mention it? But it's where people with lived experience, 2 years having their initial mental health engagement, would support other service users who are now entering that phase of engagement with the mental health services and their families, to support them to get the best outcomes and to be able to manage their illnesses. And that's a huge step forward. I'm going to read a little bit. I suppose, again, like Catherine, I would invite you all to spend some time browsing with the Bragg and the Steel exhibition. Provides to showcase the best practice related to recovery-orientated service throughout all three areas. And today is all about learning from each other, forging new alliances, because I suppose we all need to do it together, and improved ways of working. CHO has been successful in funding for the recovery plan, and I want to thank Ari for that, and in keeping with the principles of the national framework, which this is now the way forward for all of us, and I hope you all get a copy and work through that. We got education funding, I suppose, to run another couple of events in terms of education, so that we can build good capacity in our area, so that everybody is able to develop and co-produce what services are going to look like for the future. And I suppose Kilbarrack, I went down to that stand down there, and people need to go down and see that they meet the service users on a regular basis, and they all decide together, well, how our services are going to be presented and how we're going to work through them for the next couple of years. I suppose the other thing about this is we've started the process, we've developed a number of processes, we've developed co-production. Now it's time for us to kind of take stock of that, to look at what we're doing, to look at sharing our learning, to look at what the challenges are, identifying the gaps and bridging all of the gaps. So we're sure that we will have a good service going to the future, because remember, we've all had the experience of mental health services now. We need to have it right for the future, for those who are coming behind us, so that we can actually say, yes, we contributed to recovery in Ireland. I suppose one of the benefits too in relation to the being an RE site for CHO 9 is that we are supported through recovery training. We're supported with the tools that they are to have developed, and we're supported through the capacity building that they provide for all the service users, families, carers and staff. I suppose feedback from the teams participating in these workshops in our area has been very positive, and we will continue to roll out training across the service with the aim of staff availing of the training as well. And this will enhance service user experience going forward into the future. And again, as I mentioned, the introduction of the National Recovery Framework for Mental Health Services provides clear guidance with the expectation on services in terms of integration recovery principles to all aspects of service provision. In CHO 9, we have a recovery steering group which includes staff and service users from adults and child and adolescent mental health services. And the central role of this group is to develop a recovery strategy in consultation with staff, service users to ensure the implementation of the National Recovery Framework. And I suppose that's key to my heart as well, is that, you know, we focus on child and adolescent mental health services, because I think that's the key to improving lives of service users, is that if we can actually develop good recovery principles, co-production in terms of child and adolescent services, good carer forums who are influencing how care is provided, support, peer support for one another, that we will have better outcomes for people who engage in mental health services right into the future. I suppose, just to give you a little flavour of some of the initiatives that are in 7, 8 and 9, and I suppose you'll see them down on the presentations down there. We have the Recovery Hub, we have Kickstart, over-the-line football teams, OLAS Wrap, Recovery Principle workshops, the Hub newsletter, co-production of psychoeducation programmes, and the North Dublin Trilogue. I suppose my piece is that we all must continue to push the recovery agenda through small steps locally, big steps nationally, like events like this. We need to engage with all mental health services so that the future will be one that will be a positive experience for all those who engage in the mental health services. And I'd like to thank you all for giving of your time today, and I hope that you will go away with new vigour and new ideas to further develop recovery in your services. Thank you very much.